Dr. Silva here, and we are about to perform a right-sided stellate ganglion block. We are using just ropivacaine today, and in a few minutes you'll see that I'm scanning the neck with the ultrasound, carefully scanning for nerves and blood vessels to get that medicine right at the stellate ganglion. So you can look at her eyes, and one of the signs of a successful stellate ganglion block is a change in the pupil, redness, and a droopy eyelid, what we call Horner syndrome. So you can see everything symmetrical, and after the stellate ganglion block is performed, you'll see that the changes have occurred. Today we're using strictly ropivacaine, which is a numbing solution. I choose ropivacaine because it's the safest to use with the least incidence of arrhythmia, seizure, should it accidentally go into the blood vessels. And we have a special syringe here that we use that we call a control syringe. It allows me to have better control so that before I inject this medicine, I pull back using this little thumb gripper to make sure that I'm not pulling any blood or any other kind of fluid before I actually inject that numbing medicine around the nerve. In this patient, it's especially important to use ultrasound to guide this injection instead of doing a blind injection or a fluoroscopy guided injection, because she has an unusual anatomy after having this surgery in her neck. And so it allows me to see all of the soft tissue parts to prevent them from being injured during the procedure. Doing okay?
Mm-hmm.
Was that painful at all?
Nope.
All right. It really shouldn't be painful, and any minute now we'll start to see that response. So we just finished the stellate ganglion block. She did pretty good with it, had no pain. After the block, we wait 30 minutes. She's observed, we're watching vitals, and we start a nice relaxing environment to help kickstart that parasympathetic tone. If you want to come over here, you can actually look at her eyes. You can see the pupil is smaller on this side compared to that side. And the eyelid is starting to get a little more closed or droopy. Like I said, in some patients it's strongly pronounced, in other patients it's a little more subtle.